Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. There's been so much comments to us, this is your show, and there's a lot of talk to us and come to us relative to joint replacement. I just thought that there's a wonderful new emerging, if not long-standing program, but it's changing quite a bit up at Broward Health North. And so I figured, they're making a lot of changes. They're building a lot of new ORs, and they're doing a lot of the operating rooms, and they're doing a lot of changes. So I figured I would bring in not only the coordinator of the joint replacement program, who is a nurse professional, and that's Tiffany Cronin. Tiffany, welcome.
Thank you very much.
Good
Thanks
to have
for
you.
having us.
And of course, you can't coordinate anything without the surgeons. So we have Dr. Charles Toman, who is as we were talking before the show, local, brought-up person right across the line in Boca, which is sort of a stone's throw almost to Broward Health North. And I understand that you specialize in shoulder and other joint issues, but particularly shoulders. Welcome, Dr.
Thank you
Toman.
so much.
So talk to me about your work.
My specialty is really shoulder surgery and the non-operative treatment of shoulder injuries. So my training is relatively diverse. I mean, I still take care of patients with knee and hip issues, but we've really tried to focus in on shoulder injuries. I feel this is an underserved area, even when you're going to see an orthopedic surgeon. There are many surgeons that they have a fair amount of knowledge about shoulders, but they don't really dig deep and really embrace it. I find shoulders to be a little bit more complicated than hips and knees. I mean, my colleagues that focus on hips and knees would argue that point, but I think the shoulder is a fascinating joint because it's a combination of bony anatomy that is critically important, but almost more important for shoulders is the balance of soft tissues. So that people hear about rotator cuffs, those are tendons. They hear about ligaments and things. Those are all soft tissues. We have to deal with muscle in order to have the shoulder work properly. So I find it to be a little bit more complicated. It's less cookie cutter. It's more personalized. It's really the art of medicine still exists. We have a huge focus on evidence-based medicine. And I know there are clinical trials and programs that are going on even at this institution where evidence-based medicine is becoming the norm, the standard. But as a physician, I still like to be an artist a little bit. And when you have to find balance in soft tissues and tightening things and loosening things, it makes it a little bit more different, a little bit more difficult, I think, a little bit more satisfying than just rote memorization or following a recipe, so to speak.
So, in order to coordinate, you have to have people like Dr. Toman. Tell us about what you do as the coordinator for the joint replacement program.
Well,
other than being a good nurse professional.
Thank you very much. As a coordinator, I work very closely with the surgeons' offices and with the coordinators at their offices as well. As soon as they determine a patient is going to have a particular surgery, whether it is hip or knee replacement, they send me the patient's information and I contact the patient and we have them come in for a pre-op orientation class. And during this time, it's a 2-hour period where the patients will come into the hospital and they will meet with an anesthesiologist individually to have those questions answered and have a little personal sit down with that anesthesiologist to feel more comfortable about that aspect of the surgical process. And they also register for their surgery. We give them some preoperative information. We do a class with a slideshow that gives them a lot of information as to what they should know about the types of therapy we do and the discharge process and all the other things we do as a program at Broward Health North.
Do you also, and I'm going to talk to Dr. Toman about it, do you talk to them about the period of time when, after Dr. Toman is finished with his art of medicine, the rehab issues?
Yes, we actually have our lead physical therapist come in to the class and speak to them specifically about the rehab process within the hospital, and then we collectively discuss with them the continued rehab post-discharge.
Okay. Dr. Toman, you know, we have a very interesting population that we serve here through the health systems, both through Broward Health and the multiple hospital corporations and other public institutions, and you know, we're pretty lucky, I guess, as a human group, to be able to have so much medical care available to us. But I think the thing that makes people ask questions about things like shoulder and joint replacement is they're very interested in the pain and the minimally invasive techniques. I would say that the number one and number two questions that come to us are always about pain, because in their eyes, cutting is pain, surgery is pain, minimally invasive surgery portends to them less pain and less cutting. So let's talk a bit about it.
You know, I think that's a great point. I mean, the greatest, almost the greatest amount of time I need to spend with a patient is discussing exactly what you said, is that not the surgery. They don't really need to understand the surgery in the greatest detail, but they want to know how long it's going to take for them to get better, how long they're going to be in the hospital. Do they even have to be in the hospital? How much pain are they going to have? So pain is critical. And I think that, you know, one of the innovations, we were talking about innovations in medicine as well, and one of the innovations that we have is regional anesthesia. And so when a doctor says regional anesthesia, I mean, other doctors understand that, but what that means to a patient is that we actually will put extremities like an arm or a hand or a knee or part of a leg to sleep, temporarily utilizing medicines that you would use, that most people have familiarity with by going to the dentist, like Novocaine. So we don't use Novocaine to do that, but our anesthesia professionals really have started to master some of the techniques using ultrasound and electrical stimulation and things to identify the nerves that actually are giving patients pain, and we can actually turn those off temporarily. People say, oh, well, I'd love to have that last for a long time. Well, thankfully, combinations of medications that are available at the different hospital systems allow us to put, say, an arm to sleep for 12 or 14 hours. That allows people to have pain medicine on board after surgery so that they don't wake up in excruciating, horrible pain. And so many of the surgeries that once required hospitalization are now able to be done as an outpatient at Broward North. Additionally, when we talk about minimally invasive surgery, I mean, literally that is what we do. I mean, you can do a rotator cuff repair on a shoulder with an open incision. And I've seen patients who have had incisions that are 8 or 12 inches long just to sew up a couple of tendons. I can tell you that in my 8 years of practice, I've never opened a shoulder to fix a rotator cuff. And that doesn't mean that anything other than the fact that I have been fortunate enough to have the opportunity to work with some great, fantastic surgeons and mentors who've showed me how to do those procedures with a camera. So through 3 or 4 little poke holes, no bigger than a pen, I'm able to evaluate the joint, repair the tendon, and do anything that you would be able to do open, probably better, and obviously with less pain, quicker recovery, and all of those things. So innovation with regard to arthroscopic or rotator cuff or ligament injuries. I mean, I did 7 shoulder surgeries on Tuesday, and the biggest incision I made was smaller than my pinky nail. And you know, that's fantastic for patients. I mean, that makes things better. Pain is much less afterwards. Rehabilitation protocols have now been adjusted and modified so that literally I'm using a CPM machine, which is a machine that actually moves the arm up and down to prevent scar tissue formation, which can be very painful. We're using more advanced rehabilitation protocols where we're actually looking at the science and finding out how long it takes for tendons to heal to bone. So once where I had to keep people in a sling for 6 weeks, now a lot of times I'm keeping people in the sling only for 2 weeks. You know, in 2 weeks in a sling versus 6, that could be the difference between you losing your job, where you can't drive and you can't perform at work, you know, and it definitely decreases the amount of independence you have. I mean, thankfully, we have different services now that facilitate people getting from one direction to another pretty easily just using your phone. But ultimately, people want to have control of their lives, and part of that is being able to drive and to take care of themselves. So,
you know, we have this broad spectrum of population. I'm talking about the age characteristics of our population in South Florida. I mean, we have a lot of retirees who, you know, have established a financially secure future, in essence, and they've come here after a viable life function. All they want is a quality of life. And then you have this unbelievably large group of people between ages 0 and 14. We have one of the largest school system groupings in the United States. I mean, right here in South Florida between Dade, Broward, and Palm Beach County. And you see the growth in Palm Beach County. You grew up, as you said, in Boca Raton, but look at the change in the population in South Palm Beach County. It's huge. But you have a lot of these folks want, like I said, they want a quality of life. So, and a lot of these people are very active. So this is sort of a general question because I not to label it as sports injuries, but many people are very active, and a lot of their problems show up in joints, either by overactivity or inappropriate stretching or inappropriate warm-up activity and things of that nature. Am I in the right area? Do you see a lot of that because of your...
I mean, it's, sorry to interrupt, but yeah, no, that's overwhelmingly what I do. My practice, I mean, as an orthopedic surgeon trained in sports medicine and joint replacements, I tell my patients, I save 1 or 2 people a year from dying. Okay, that's not my job. My job is quality of life. So I tell people I'm a quality of life doctor. I improve people's quality of life when they have failed conservative treatments, which can include injections and therapies and all of these things. But despite our greatest efforts on the front of physical therapy, I mean, my parents are both physical therapists. My wife is an occupational therapist. I love therapists. Like literally, I have to love therapists in my house. And I have a lot of respect for that. But ultimately, I'm an orthopedic surgeon that fixes people's problems so they can play tennis, so that they can play catch with their kids, so that they can go for a jog, so that they can dance, so that they can shop with their grandkids. I can't tell you how many people I've taken care of who are telling me about Disney World trips with their grandkids that they've had planned for years, literally, and we've been able to give them back that opportunity to really enjoy their life again. So that, you know, and then the tough part with that is that sometimes I'll meet those people 6 weeks before they're going on their trip, and then they want to know about minimally invasive. And so thankfully, in my practice, you know, we've adopted minimally invasive techniques for knee replacement, say for instance. I don't zip open the knee. I make a 10-centimeter incision. I use a computer to navigate the knee, which basically limits our need to be as invasive in setting up the alignment of these knee replacements and things we're doing. In the shoulder, the most innovative thing right now is something called patient-specific instrumentation. And what that means is that before the surgery, we send patients for an imaging study, a CT scan, which shows us the three-dimensional anatomy of the shoulder, something that I cannot appreciate in the operating room, even if you're opened up. So we're doing that beforehand. We're doing the surgery basically on a webinar with the engineers who actually make the implants. And we're allowed, basically through this technology, we're allowed to make custom tools to use to put these shoulder replacements in. And we're able to basically do the procedure beforehand, have it set up perfect, walk into the operating room with these specifically made pieces for specific patients, put those tools on the patient, put the pins in, verify everything, you know, obviously because the art of medicine still exists. I mean, I am the art of medicine in that scenario, confirming all that, and then putting a perfect shoulder replacement into someone, which, if it's perfect, 2 weeks later, they're out of their sling. 6 weeks later, they're finished with therapy. 6 weeks later, they're at Disney World with their grandkids. So that's what my job is in medicine. My job is not to save people, maybe once or twice a year. My job is to basically save the quality of life of hundreds of people throughout the year.
How satisfying. What do you think, Tiffany Cronin? Is pretty good to be able to coordinate services with physicians like this?
It is, because as you were both saying, it's, a big question on people's mind is, pain, as well as when can I get back to my normal life? We have a large population of older people that live here alone. They're nervous about returning to be able to take care of themselves in their homes alone. We also have a lot of younger people that we see who need hip replacements or knee replacements, and they need to get back to work. So they need to know that their quality of life will be intact and that it won't take them a tremendous amount of time to recover. So it's really rewarding to be able to help them through that process and educate them through that process and really keep an eye on everything that they're going through and be that person, that contact person for them, to be able to give them somebody established in the hospital that they know that they can come to for questions and what do I do for this and where do I go for that. But we do have a large number of people, like you said, when can I go to Disney World? I'm going on a cruise. They want to know that they can get back on their feet very quickly.
But also what's important is, as Dr. Toman was saying, with a whole family of rehabilitation folks there, you also have the responsibility as a coordinator of that unit, providing direction, information, oversight of their rehabilitative process, correct?
Correct. Yeah, I spend a lot of time with the patients from before they even come into the hospital through their discharge. We call them after they leave. We check in with them, make sure that they're doing well, they have everything they need, that they're doing their rehab and everything is going smoothly and their pain is under control. We do a lot of, throughout the continuum, a lot of contact with the patients.
I know you have a lot of occupational therapists that are there as well.
We have occupational therapy, we
Right.
have physical therapy, we
Right.
have speech therapy, we have orthopedic technicians. We have a whole multidisciplinary team that works
The
with these
reason I
patients.
say that is because a lot of folks really don't know what an occupational therapist does, and often they, and of course, I go back over the years, there always was this tension between physical therapy and occupational therapy, which is gone now, basically, unless it's in your household.
We'll see. It's a house divided.
Yeah,
in my
I
house.
understand that. But really, occupational therapists are really, they're an imperative. If you're coordinating their rehabilitation, the occupational therapist is necessary for a lot of reasons. I mean, they may have to go into the home. They may even have to help someone understand how to deal with an automobile a little bit differently, things of that nature, which is not the physical therapy portion of it, but it's the connection between the physical and the mental issues that are part of the occupational therapist regimen. So I'm sure that you see that, correct?
Yeah, each member of our team is really, really important in the patient's total care.
Right.
Because yes, it's important that they know how to do their exercises, but they also need to know how to get their pants on and their socks and shoes on. So the occupational therapist is really important to us in making sure that when they do go home, they can take care of themselves, they can get themselves ready and do all those details every day.
And what they can do relative to reaching into a closet and taking a glass of water, simple things.
And that's very important for what I do. I mean, with my focus being shoulders, I have a great relationship with occupational therapists, and oftentimes the patients don't understand, it's almost a misnomer, because when we deal with patients that are having workers' compensation and all of these things, and you'd think occupational, well, it has to do with your ability to be a plumber or to be an electrician or something like that. But in essence, what it is activities of daily living. And I think that's kind of what we were dancing around here is, can you turn on your kitchen stove? Can you fry an egg? Can you do all of these things? Can you, pull your pants up? So I think that's important. But in my world, occupational therapists take care of a lot of shoulder post-op rehab, a lot of pre-rehab, but also physical therapists. So, but it's a very good point. I mean, we can't, the surgeon is the small piece of the wedge. And the entirety of the wedge is really the nurses, the physical therapists, the assistants, the aides, the x-ray technicians, everyone. And I think the most exciting thing for me in joining the team at Broward North is the fact that the surgeons and the team who are already there before me have done such a fantastic job developing a program that is known throughout the Tri-County area as a fantastic place for joint replacements and for patient care. I mean, the first thing that they said to me is, Dr. Toman, you've got fancy credentials, you look really nice in your suit, but ultimately what we care about is patients and the care that we provide patients. We care about every score. We want to strive to be the best. And I told them, all I want to do is shoulders, and all I want to do is make you guys look even better than you look now. And so they've afforded me that opportunity for me to be able to be on this show, speaking with you after literally just starting up months ago. I think that we're going to do some special things at Broward North.
I really think that the future of healthcare, which is here, it's not next year, it's right now, is really something which is very exciting because, again, you talk about the art of medicine. The art of medicine is the only thing that's viewed, when it really gets down to it, by the patient. I know that it's the application of the art by trained people such as yourself, but really the patient is where it's all at, and they are the benefactors of the changes in our healthcare system. Let me ask you a question, because we have a lot of folks to talk to us about. We got a lot of weekend warriors, sports folks, go out and play golf and tennis and swim, because we do have we have a lot of what I would call the medical survivors. People come to South Florida. They're somewhere between the ages of 65 and 80, and they're still very active as athletes. In my case, would be a pseudo-athlete, but active. What is your suggestion relative to what an individual should be doing relative to exercise and hydration? I always ask our orthopedic folks who come before us, I ask them those questions because I know how important it is, but I want you to tell us.
Well, as a sports physician, which is a component of my practice, we come up with questions like that a lot. How do people want to know how to stay healthy, how to stay out of my office? And I tell them the secret, it's very simple. I mean, the key really, and this is really something a cardiologist would probably talk to you more clearly about, or an internal medicine doctor, primary care physician, but ultimately it's cardiovascular health is critical. So exercise, 30 minutes a day, every other day, is going to do more for you than anything. And when I say exercise, it's going for a walk. That's for getting on the treadmill or the elliptical machine at your gym. That is critically important for your overall health. When it gets to specific sports issues and orthopedics, what I find is that people will happily, or almost happily, go to the gym and lift weights because they see that lifting weights, you're doing something, it's something exciting. Other people are watching you. Maybe you see some gains, your muscles get a little bit bigger. What people forget to do is they forget to stretch. And so flexibility is something, as we get older, and I'm 37, and I feel much older at 37 than I did at 32. And a function of that is 4 little kids and busy practice and all those things. But ultimately, it's if I have an opportunity for 30 minutes to exercise, well, I'll go for a jog. But I'm not spending any time doing flexibility. So what I've been telling people lately is to try to focus on yoga, Pilates, things like that, where there's a component of strengthening, there's a component of flexibility, and there's also a mental component. I think sleeping well through the night, I think eating relatively well, having your fruits and vegetables, all the things that your parents told you and your pediatricians told you, these are things that we forget in our busy lives.
We're down to the last 2 minutes of this show. So I want you, Tiffany, if you would, give me that last piece of information about the joint replacement program at Broward Health North, and then we're going to go to Dr. Toman to close up. Okay.
Another component, since we're talking about the mental well-being as well as physical well-being, we also do some things with our patients while they're in the hospital. We have everybody come down for lunch together a couple of times a week to get them out of their hospital rooms and get them socializing, so it feels more like just like a little community type feeling, that they're all just kind of hanging out together and having a nice big lunch. And we also invite them back for a reunion luncheon where we put on this really beautiful, it's a nice hot buffet luncheon. We give away prizes, we have a DJ, they can dance, and we have the patients who have had their surgeries about 4 months out come back and enjoy that as well, so we can celebrate their recovery, celebrate how well they're doing after their surgery. So we want to take care of the whole picture, not just the physical body.
Well, thank you for all your hard work.
Thank you.
Thank you for the joint replacement program.
Thank you.
And Dr. Toman, I'm glad you're here. And you said you're 37. I hate to tell you this, but I have ties older than you. But but the truth is that I appreciate the manner in which you have presented not only knowledge, but your willingness to understand that the art of medicine is really the significant element of the conduct of a patient and the relationship that the patient has with the doctor. It isn't just to cut and do whatever and take care of you and give you medication, write a prescription. The art of medicine is the personal contact, the willingness to advocate for the patient, and the patient's loyalty to you and trust in you, and that's really the art of medicine. I want to thank you for your advocacy.
Thank you. That's the human component.
Yes, sir.
We're people. We're all people.
That's what it's it. We're all people. Thank you very much. Say hello to all those occupational therapists and physical therapists at home. Tell them that we have one of the finest occupational therapy and physical therapy programs in the United States, right here at Nova Southeastern. Folks, I hope we answered some of your questions. Certainly, we got into the area of something which you constantly ask about, that's minimally invasive surgical techniques and pain, and we wanted to talk about joint replacement, and here we got it. We got it right now. So if you have any questions, you have any comments, there's an email address right here and a telephone number. Just give us a call or send us a little email. We'll try to get you the answers. And remember, as I always tell you, and Dr. Toman was sort of saying what I always say to you, you got to take good care of yourself. The only way you take good care of yourself is just listen to what he said. It sounds like it's a recipe for respecting yourself and helping you live a more helpful life. So this show is called Dateline Health. We come to you from Nova Southeastern University. And until next time, my name is Fred Lippman. See ya.